Welcome to our My Health Matters folder workshop. We're excited to be here with you. We would like to start with an acknowledgement of country. The acknowledgement uses plain English and was written by people with intellectual disability, as well as First Nations people.
We know we are on Aboriginal land, and we respect the Aboriginal people from this land. On this land, we live, work, play, swim, and dream. Aboriginal people have lived on this land for many years, and now we live on this land together. We respect all Aboriginal people and elders. We respect all Aboriginal people and elders who have lived in the past. We can learn a lot from all their stories, and we can learn a lot from each other.
Talking about health can involve personal and private information. It can bring up different feelings too. You can pause the video and take a break at any time. Now Manon will introduce us.
My name is Manon. I am a project worker. This is Vicky. Vicky is a project officer. Vicky and I will present together. We are both part of the health team at the Council for Intellectual Disability.
The Council for Intellectual Disability, or CID, is a disability rights organization. We have been led by people with intellectual disability for 70 years. We speak up on the big issues. We provide information and learning opportunities, and we empower individuals and communities. The name of the project that Manon and I work on is Just Include Me. Our work is funded by the Australian Government Department of Health, Disability and Aging. We call the project Just Include Me because people with intellectual disability have a right to be included in healthcare. We want people with intellectual disability to have good healthcare and good health. Before we begin, we invite you now to think about your experiences with healthcare. You might remember a time when a doctor, nurse, or a health professional spoke to someone else instead of speaking directly to you.
This has happened to me. A doctor spoke to my mum instead of speaking to me.
You may also remember times when you did not understand what a doctor was telling you about your health, treatment, or medication.
This happened to me. The doctor spoke too fast and used words I did not know. I did not understand what they meant.
Or perhaps there was a time when you felt you were not able to make your own decisions about your healthcare.
I have felt like that before. People were talking about my healthcare without asking me what I thought. I would like to be included in the decision.
Thank you for sharing that, Manon. You can pause this video to think about your own experiences with healthcare. Today, we want to share a tool that can help you have better experiences with healthcare, the My Health Matters folder. After today, you will know how to use the folder to support your health and healthcare. This folder is for all your health information. You can use it to write what you want people to know about your health. You can take it with you when you go to your doctor or health worker. It would help your health workers learn more about you and your health. There is also a digital copy of this folder. You can use the folder on the computer, on a mobile phone, on a tablet like an iPad. While you watch this video, it would be helpful to have the My Health Matters folder with you or to have it open on your device.
In today's workshop, we are going to talk about how to use your folder when you see a health worker, why your folder is helpful, who can help you use the folder, and keeping your health information safe. Let's start by watching a video. In the video, Leonie tells us how she uses her health folder.
I use the My Health Matters folder to speak up for myself. I love the folder because it means my health information is mine. I use the folder to tell my doctor, psychologist and neurologist how I communicate and how I make my health choices. I have written in the folder about how mostly I can make my own health choices. You can use the My Health Matters folder like I have in your next health appointment. When you use the folder, I hope you feel like I do. I feel my health worker listens to me and includes me.
The folder helps Leonie speak up for herself. The folder helps Leonie control her health information. She says, "My health information is mine." The folder helps Leonie tell health workers how she communicates and makes decisions. The folder helps Leonie feel that her health workers listen to her and include her.
Now we invite you to pause the video and to look through your folder. You might like to write your name on page 6. We will put the page number we are talking about in the corner of each slide. This page is called My Personal Information. You can pause the video now. Welcome back. Now let's talk about what's in your folder. We will look through the important parts together. You might like to follow along in your folder. The folder has 3 parts: About Me, My Medical Information, and Tools for my appointment. There is a coloured tab for each part. As we look at the parts of the folder, we will watch a video about Brody and see how he uses his folder. The video starts with Brody arriving at an appointment with his GP, Dr. Carey.
Okay, hi Brody. Thanks a lot for coming in today.
I show Dr. Carey information all about me and my health. Would you like to have a...
I would love to have a look. Thank you so
Sure,
much.
no
Yeah, it'd be great to go through this together.
Sure. Once Dr. Carey has read it, she asks me questions. This makes talking to each other easier.
Now let's look at the first part of the folder. You can use part 1, About Me, to tell people all about you. About Me starts on page 5. This part includes personal information like your name, birth date, and address. Let's look at some important pages.
The first important part starts on page 8. It is called How I Tell People Things. Health workers need to know how you tell people what you want, what you need, and if something is not right. This will help them know how to talk to you.
On the next page, there is a list of ways you tell people things. When you fill out your folder, tick the ones that you use. For example, some people use sign language or a tablet. Brody uses the folder to explain how he says yes, no, or that he does not know. Let's watch the video.
I've written in my folder that at health appointments, I don't feel comfortable saying the words yes and no.
So Brody, we had a bit of a chat about maybe having a blood test to see why you might be feeling unwell today.
I say no by showing a thumbs down.
Would you be able to show me if you're happy to go ahead with
I say yes by showing a thumbs up.
Okay, that's great.
And I say I do not know by shrugging my shoulders.
Another important part is on page 13. It is called How to Support Me. Health workers need to know how to support you. When you fill out your folder, write down what support you may need. For example, you might need information in EasyRead or a support worker to come to appointments with you.
Now, let's look at a fun page together. Page 14 is called What I Like. You can use this page to write down what you like. This might be things you like to do, people or pets you like, or your favorite movie or music. You can write, draw, or use stickers. You can pause the video now to complete your What I Like page.
Thank you for completing the What I Like page. Let's have a look at what I did in my own folder. I wrote down some of my favorite things I like. I like spending time with my family and friends. I like listening to music and watching movies. I also included photos of my pets. Your page might look different from mine, and that is okay. This page is about the things that are important to you.
Thank you, Manon, for sharing that with us. Now, let's look at part 2, My Medical Information. This part starts on page 20. You can use this part to tell people about your medical information. It's for you to have all your health information in one place. For example, you can include your allergies, important contacts like family, support workers, or guardian, card numbers like your Medicare or health care card, NDIS plan, and health plans. Let's look at some important pages.
Let's talk about health choices. This part is called Health Choices, and it starts on page 28. You can make health choices about things like doing a test, like a blood test, or taking medications. You can tell your health workers if you need support with your health choices. When you fill out your folder, write whether you make your own health choices or need support. Let's watch Dr. Kerry tell us what she learnt about Brody's health choices from his folder.
Brody's folder, for example, has a part about health choices. Brody has showed us this part and made it clear he makes his own health choices. Understanding this now, we always ask Brody about his health decisions.
Another important part is on page 30. It is called My Medical History. Your medical history means your health issues, times you went to the doctor or hospital, and your medicines. You can ask your doctor to write down your medical history. If you need more blank pages, you can print them from our website. The next important part starts on page 34. It is called My Health Workers. This part is for the names and phone numbers of the health workers you see. When you fill out your folder, there are boxes you can tick for other kinds of health workers. For example, you might see a hearing specialist or Aboriginal health worker.
Now let's talk about part 3, Tools for My Appointment. This part starts on page 43. You can use this part to show health workers how you are feeling. Let's look at some useful tools. On the next page, there is a tool. Page 44 is called How Sick I Feel Today. Let's hear from Brody about how he uses the tool.
I feel more confident going to health appointments with my folder. I point at the tools in the folder. One of the tools is I have these feelings today.
Would you mind pointing to one of the faces to show me how sick you feel today?
I'm feeling about that one.
Okay, well, maybe we'll have a look into that a bit further for you.
This makes it easier to talk about my feelings.
Another useful tool is on page 46. It is called I Have These Feelings Today. You can point to show how you feel. For example, you might be feeling scared, excited, or stressed. Thanks for looking through the folder with us. There is a lot of personal information in your folder, and it is very important to keep your information safe. Remember to keep your folder in a safe place and only show the folder to people you trust.
Now, let's talk about people and places that are safe to share your folder. We're going to read out some examples. Let's get started. Manon, is it safe to share your folder with your doctor in an appointment?
Yes, your doctor may need the information in your folder to support your healthcare.
Is it safe to share your folder with a pharmacist in the store?
Yes, a pharmacist may need information about your medicines and health needs.
Is it safe to share your folder with a family member or a support worker at home?
Yes, if they help you with your healthcare and if you want to share it with them.
Is it safe to share your folder with strangers on the bus?
No, your folder has private information about you.
Is it safe to share your folder with new people at an event?
No, only share your folder with people you trust or people who help you with your healthcare.
Thank you, Manon. Remember to keep your folder in a safe place and to only show the folder to the people you trust. Now, we're going to talk about who can support you with your folder. Manon, who helps you to fill in and use your folder?
My mum and my support worker Sarah helped me to fill in my folder. Different people can help you with your folder too. This could be a family member, a support worker, your doctor or your GP, or another health professional. After today, you can take your time to fill in your folder. If you want, you can ask someone you trust to help you.
Now that you have learned about the My Health Matters folder, we want to tell you about other resources that you can use with your health and healthcare. All our resources are free. You can download the folder in 12 other languages. You can use the folder in Arabic, Dari, Greek, Hindi, Italian, Nepali, Punjabi, Simplified Chinese, Spanish, Tagalog, Traditional Chinese, and Vietnamese.
The My Health cards help you to have conversations about your health. They also help health workers to communicate in a more inclusive way.
The My Health Appointment form helps you prepare for a health appointment. You can also use the form to take notes with health workers before you leave an appointment.
CID has another project called My Relationships Matter. The project is about women's sexual and reproductive health. We made the My Body, My Choices cards, and the cards help women talk about our bodies, our relationships, and how to stay healthy. We also have lots of tools in Easy Read.
If you want to download these resources, you can go to our website, which is cid.org.au. You can also sign up to our newsletter on the website.
We would love to hear from you. Our contact details are on the screen. Thank you for joining us. We hope the My Health Matters folder strengthens your voice for better health and better health care. You can be the champion for your health rights. Thank you.